Hello everyone, I am Dr. Narendar, Forensic Medicine and Toxicology faculty in Koncpt. Now we are going to see one level 1 question in the chapter Identification. Coming to the question, a BDS student was asked by his chief to denote the patient's teeth in the charting method shown in the picture. The name of the dental charting technique shown in the picture is option A, Palmer's notation, B, Harrop system, C, universal system, and D, FDI system. Coming to the picture, you can see the charting starts from the upper right and goes on in a clockwise direction and ending in the lower right, starts from 1 to 32. This is for the permanent teeth. For temporary teeth or the primary teeth or deciduous teeth, it has been denoted in alphabets, starting from A in the right upper quadrant, goes in a clockwise direction and ending at alphabet T. Before going into the question, we have to know about the anatomy and the different charting techniques. Coming to the anatomy, the innermost part of the tooth is called as dentin. This part is called as dentin. Okay, it is covered in the crown by a white part called as enamel, and in the root by a part called as cementum. Okay, this is the root canal where the nerves and the vessels goes into the tooth. Normally the tooth has been classified into the crown part, the root part, and the middle part is called as neck. Coming to deciduous dentition. In both deciduous and temporary dentition, it has been divided into 4 quadrants. In deciduous dentition, the total teeth are 20 in number, that is 5 in each quadrant. This is the medialmost tooth is the central incisor. Next one is lateral incisor, then the canine, then the first molar, then the second molar. The most important thing is there are no premolars in deciduous dentition. Coming to permanent dentition, it has 32 teeth totally, 8 in each quadrant. Coming to the medialmost part, this is the central incisor, lateral incisor, canine, first premolar. Here comes the premolar. This is the second premolar. This is the first molar. This is the second molar, and this is the third molar, or also called as wisdom teeth. Okay, coming to the different charting techniques, this is the thing which has been given in the question. Starts from the upper right, also called as right maxillary. This is left maxillary, this is left mandibular, and this is right mandibular. Starts from the right maxillary, third molar, that is the first tooth. It goes in a clockwise direction and then ends in the right mandibular, third molar, that is the 32nd tooth. For deciduous dentition, it is denoted in alphabets. Starts from A in the right maxillary, second molar, and then goes in a clockwise direction and ends in the right mandibular second molar, that is T. Coming to Palmer's notation, here the denotation starts from the central incisor 1 to 8 in the permanent teeth in all the quadrants. For deciduous teeth, it is denoted in alphabets A to E, starting from the central incisor. Okay. Coming to hair trap system, it is denoted by plus symbol for upper teeth and minus symbol for the lower teeth. It is same as the Palmer's notation, but a plus symbol has been designated for upper teeth and minus symbol for the lower teeth. For FDI system, there are 2 digits denotation in for each tooth. Suppose if you take this tooth, it should not be called as 11, it should be called as 1 1. The first digit denotes the which quadrant it is, and the second digit denotes the which tooth it is. Therefore, for the first digit, the quadrant has to be designated numbers 1, 2, 3 and 4. Okay, this is right maxillary, this is left maxillary, this is left mandibular, and this is right mandibular. The 1 denotes the central incisor, and then it goes, this is the lateral incisor for the second, canine for the third, and goes on like this. Okay. For deciduous teeth, the denotation changes for the quadrants 5, 6, 7 and 8. It goes in a clockwise direction. Suppose if you want to denote this teeth, you have to say what teeth it is. If it has been given as 1 7, that is 1 designates permanent right maxillary. Okay, permanent right maxillary, and which tooth it is? Second molar. 1 7 denotes permanent right maxillary second molar. This is FDA system, that is Federation Dentaire International. There is one more system called as modified FDA, that is there is nothing but a small change. For designation of the quadrant, you have formed clockwise direction in FDA system. Here starts with 1 in right maxillary, left maxillary is 2. Here right mandibular is 4, left mandibular is right mandibular is 3, left mandibular is 4. There is a small change. This is modified FDA system. One more charting technique called as diagrammatic or pictorial charting. Here they will denote even the roots, the surfaces, and even for molars, even how many cusps it has. This is diagrammatic or pictorial charting. Coming to the question, we already said this answer is universal system. Starts from the upper right, goes on to the clockwise direction and ends in the lower right. Okay, right maxillary to right mandibular. These are my references, and check for updates and follow Koncpt in each of these channels. Thank you.